thyroid gland, situated in the neck, is responsible for regulating metabolism and energy production. Thyroid diseases, ranging from hyperthyroidism to thyroid cancer, can have a profound impact on a person's overall health and well-being. Nuclear medicine has emerged as an invaluable diagnostic and therapeutic tool in the management of thyroid disorders. Its techniques allow for a comprehensive assessment of thyroid function, aiding in both diagnosis and treatment decisions. Nuclear medicine also enables the non-invasive imaging of thyroid nodules and their potential malignancy. Some techniques provide insights into the functional characteristics of thyroid tissue, aiding clinicians in distinguishing between benign and malignant nodules. By facilitating early and accurate diagnosis, nuclear medicine contributes significantly to improved patient outcome and tailored treatment plans in thyroid diseases. Today on your regular Health Talk TV show, we'll be discussing the role of nuclear medicine in thyroid diseases. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Thyroid nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Thyroid from LB Pharma. Thyroid, love yourself.
It's another day with the physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbere, your regular anchor on this program. I'll be discussing the role of nuclear medicine in thyroid diseases. I'm not alone to anchor today. I have with me my regular co-host, always looking beautiful, no other person than...
I'm Dr. Momodu Yusuf Kadri, of course, on your favorite health TV talk show. Your health is always our business and will always
be our business. I love it. Now we're talking about the role of nuclear medicine in thyroid diseases. You know, nuclear medicine, you know, when the guest, there was a time the guest came and we talked, she enlightened our viewers, they can actually attest to that, on what nuclear medicine is all about. Yes, okay, and it made differentiation between, yes.
We were really,
in fact, at that stage, I actually was thinking, like, so why not just go straight and do the investigation? Using straight on instead of going, yes.
Medicine and molecular imaging.
Yes.
Instead of going through the scan here,
yes.
do this here, do that one, then
before
eventually now get there. It's long process, emotionally draining,
yes.
money draining, and all the.
I'm particularly excited today in today's own because it's, we're going to be talking about the thyroid disease using.
I'm more excited. You know why? For my area of specialty as a psychiatrist, the studies shows that women are twice likely to be more depressed than men.
Okay.
And so sometimes we'll see women walking in with frank depressive symptoms. Dr. May, I'm dying, something is happening to me and all that. Just doing a thyroid test. I will not let you know. Go and see the endocrinologist.
And they'll be wondering why you're asking them to go.
In fact, no, a lot of them question me. Why should I do thyroid?
When I
tell you I'm having low mood, I'm not sleeping well, my body is doing this, I'm sweating, I'm this, I'm that. I tell them to go and do test. I say, go and do thyroid test. And lo and behold, they come by just referring to the endocrinologist to replace the thyroxine that is low in the system. You see their mood picks up and all those symptoms, reduces.
Wow, so thyroid and depression.
Yeah, no.
That'll be a topic for another day. You have to handle that one. We'll be back. For our viewers out there, we'll be back after the short break. Don't go away.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Thyroid nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Thyroid from LB Pharma. Thyroid, love yourself.
Welcome back. If you have just joined us here on your regular health TV talk show, The Physicians, where your health is our business. Today we'll be discussing the role of nuclear medicine in thyroid diseases. And in the studio with me is a nuclear medicine physician and a molecular imaging specialist. No other one than Dr. Jaleelat Momodu. We're actually very privileged to have her here as our guest, because we have just about 22 of them in Nigeria. And how many of them are actually practicing here? She'll tell us in the course of the program. You're welcome to our program.
Thank you for having me.
You're welcome, Dr.
Nice
Momodu.
smile. I love your glasses.
And of
Thank
course,
you.
thank you once again for honoring our invitation.
Thank you for having me.
Okay, so we're going straight. So today we'll be talking about the role of nuclear medicine in thyroid diseases. And let's talk about the thyroid gland a little. You want to just tell us a bit, where is it located? What does it do? Then, before you now talk about, does nuclear medicine really play any role, significant role in its management?
Okay. Thank you again for having me. So the thyroid gland is a small bowl, like a bow tie shaped gland in the neck. It's a very small gland, but it has such a huge role in metabolism of the body. It produces the thyroid hormone, which does many things like regulating several functions in the body. And dysfunction in the thyroid gland can manifest in so many ways. Unfortunately, in Nigeria, we tend to have a high prevalence of thyroid diseases, both benign and malignant.
Okay.
And nuclear medicine plays a role actually in both scenarios. So even though you don't have a cancer, when you have a problem with your thyroid gland, which could be a hyperfunctioning gland or a low functioning gland or underfunctioning gland, the nuclear medicine plays a role.
Okay.
And then also in the management of thyroid cancer, so patients who have had treatment for thyroid cancer, nuclear medicine also plays a role.
Okay.
So yeah, we love the thyroid gland.
Yes, because you talked about the role of the thyroid gland, and in our discussion with Dr. Memona, she also talked about it being there's this link, depression for some people like that are they are having a depression,
Yeah.
only going to do the investigation to check on the thyroid hormones. Most time when it's elevated, these are some of the things that they come down with. So do you think that for patients like that go to see Dr. Memona for depression, are they supposed to go straight to do it? Can they go, because we know that they can use blood as to
Yes.
be able to check it.
Yes.
Is there a room for those people to also do go for radioactive imaging?
So the role of nuclear medicine in thyroid disorders is complementary to existing modalities like
Okay.
biochemistry and morphological imaging like ultrasound. In fact, the most sensitive scan you want to do for a thyroid gland is an ultrasound. But then when you have a nodule, for example, in a gland, you want to know if this nodule is hyper-functioning or under-functioning, hypofunctioning. A nuclear medicine can give you that information, because our scan images function. So we can tell you, okay, this is the shape of the gland, this is the location of the gland, the size of the gland, is it looking bigger or smaller than expected? Are there any nodules in the gland? If there are any nodules, are they overfunctioning or hypofunctioning? And that information will guide the endocrinologist on how to further manage the patients. Sometimes the doctors just find something in the blood, and then they just want to confirm that, okay, are we dealing with, for example, a Graves' disease, which is responsible for the hyperfunctioning of the gland, or does this patient have a nodule that is hyperfunctioning? Because the blood picture will be similar in both cases. So we can help them differentiate what the cause of that blood picture they are seeing is. So my answer to your question would be, not every patient needs to come directly to see a nuclear medicine doctor for a thyroid scan. It will be ideal to do a biochemistry first, see your endocrinologist first, and then depending on what they find, they can now request for a nuclear
Maybe I
medicine
should have
scan.
even asked this question at the very beginning. What's actually, when you talk about nuclear medicine what does it really entail?
So,
What's the difference?
yeah, okay, so nuclear medicine uses small amounts of radiation to image, to make diagnoses, and also to treat. In this case, we're talking about thyroid diseases. So we have tracers, nuclear medicine tracers, or radiopharmaceuticals, or radioisotopes, which mimic the function of iodine, which is the normal iodine you consume when you eat, which goes to the thyroid gland. Iodine is attracted to the thyroid gland because of a special receptor on this thyroid gland. So when you give this radioactive iodine, it behaves like iodine and it goes to the thyroid gland, and then we can now image. We can now image the function of the gland.
You've talked about this radioactive iodine a couple of times. You've mentioned it a couple of times. Are there any advantages in administering this radioactive iodine therapy after surgery, for instance, for thyroid cancer?
Yes. So the current guidelines state that when you give radioactive iodine, you reduce the risk of a recurrence occurring later in future. Like I talked about microscopic disease, which you will not pick up on your normal anatomical imaging. So you may, after surgery, assume that, okay, patient is fine, and then a few years later, patient comes back with recurrence. So with radioactive iodine, when it's incorporated into the treatment protocol as a standard, that after treatment, you go for radioactive iodine scan to restage, and then depending on what they find, they can now treat. You are giving a patient a better outcomes for the disease, because you've attacked the microscopic disease. This is not to say that the chance of recurrence is completely zero, but you've reduced the risk of recurrence significantly.
Okay.
Yeah.
Dr. Jaleelat, it's getting very interesting. Okay, but I have a lot of questions to still ask you.
Thank
Now, we need to keep a date with the physicians out there. Let's hear what our people have to say. Have you heard about nuclear medicine before? How about thyroid disease? Have you heard people, or do you know of anyone who has gone for diagnosis and has told you about using a nuclear means of diagnosis in getting a result? We're back after this short break. Stay tuned.
Much about that, but from my biology, nuclear means something has to do with the cells. So that means that probably medicine that targets the nucleus of cells. So probably you're talking about healthy generation of cells, or making cells more capable, or how will I say, they generate faster.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Thyroid nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Thyroid from LB Pharma. Thyroid, love yourself.
If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We'll be discussing the role of nuclear medicine in thyroid diseases. And in the studio is our very elegant and cerebral guest. She is Dr. Jaleelat Momodu, a nuclear medicine physician, and of course a molecular imaging specialist. These are very, very big terms, right? Yeah, Dr. Jaleelat Momodu. You've been talking about this thing now. You've told us about the advantages. Okay, now, how safe is it for us to, because you talk about radioactive iodine that you want to give to the patients, and unlike the other ones where we have to, if it's x-rays they are doing, it's direct. But now you have to inject these patients. How safe is it? Let's talk about the safety.
So radioactive iodine, when you look at the spectrum of radioisotopes or radioactive materials we use in the nuclear medicine field, radioactive iodine tends to have a higher radiation dose. And what then this means is that we need to take more precaution. Even though overall the use of these radioisotopes is safe, because there's more radiation dose from radioactive iodine, we take more precautions.
Okay.
So we usually would would speak to the patients before the treatment and tell them things they need to do in terms of isolation, depending on the dose we are giving and on the national regulations on radioactive exposure, we will most times have to admit the patients for a few days, keep them in isolation so that they don't expose other people. And then we also train them on how to manage their waste, because this radioactive iodine can be excreted.
Really?
Yes, especially in urine. So they need to know how to manage waste properly. We also encourage them to drink a lot of water to enhance excretion of the radioactive iodine in urine. Radioactive iodine most commonly is administered orally, so it's actually given like a capsule. So it's like you're drinking like an antibiotic capsule, but then it contains a lot of radiation. So there are precautions we take. For the radiation officers, we would keep a certain distance from the patients. We would use lead shields. The process of preparing it and all of that, we take special precautions. So overall, it's safe because it's a risk-benefit analysis between this malignancy and the benefit of giving the radioactive treatment. So I would say overall it's safe, but as radiation workers, we take all the necessary precautions and then we advise the patients.
Okay, you said overall it's safe, and you just told us about how you will manage. You will have to tell the patient on how to manage the urine, okay, disposal. If, for instance, the person just decides to act differently, is it going to affect other people?
Yeah. So, like I said, we will typically admit them and keep them in a room, so they are isolated. So where you now have a situation where there's like contamination, there's a procedure for that. There's a procedure for managing that, because it's radioactive contamination. So you would want to cordon off the area. There are different processes you will have to go through.
Are you serious?
And then we have equipment that we use to measure the radiation in the area. So
seriously?
So you keep people away, you measure the radiation. Because radioactivity decays over time, radioactive iodine has a half-life of about 8 days. So you would lock up the area concerned, and then you wipe whatever can be wiped, but that's a different procedure entirely. And then so
if you are doing this, and how about the patients?
Yeah, the occupational hazards.
It's what? How about the patients?
Doctors, the technicians, and so then now the patient.
Yes.
There's just so much
around it.
Isolation and protocols, and the don'ts are so many.
Yes. So every nuclear medicine department has a radiation safety officer who is responsible for making sure that all protocols are adhered to. And when there's anything like this, which we call a spill, the radiation safety officer can determine if this is a major spill and minor spill, and then manage it accordingly. But as radiation workers, we are all trained on how to follow protocols and keep ourselves safe, and also keep the patients safe.
Okay.
Before now, you say airline safety is number one in the world. Now I have to add this to it, because it's almost like airline. Because if you don't do this will happen. If you don't do that, and you don't want to put yourself in that. Anyway, see, this question, we are talking about thyroid, and at the beginning I really expressed myself on how this is a major issue. In fact, at the earlier part of my practice, I wasn't so keen on women when they come and go and do a thyroid function. But with time, I realized that was a big issue. You don't just want to give a woman an antidepressant and later find out that it's a thyroid, issue. So how safe is this for women that are pregnant, especially knowing the fact that women are twice likely to be depressed, and pregnancy is another point. It's a different level of stress. So how safe is this if they have to do nuclear molecular imaging while pregnant? And the second part of this question is this, or generally, is the fact that this molecular imaging is used for treatment. What is the, I don't want to use the medical term, outcome, prognosis, what is the percentage of recovery if it's used in treatment?
Okay, so the first part of your question, we know that thyroid diseases, whether benign or malignant, they are more common in females. So we have separate guidelines for pregnant women and breastfeeding women.
Exactly.
We have a tracer called pertechnetate, which resembles iodine in the way it behaves, but it is not metabolized by the thyroid gland like iodine is. Now this tracer is called technetium. It's relatively safe. The radiation dose is lower. You can use it in scanning pregnant women without any issues, because the half-life is about 6 hours. So before the end of the day, most of radiation is gone. However, for radioactive iodine, we are a bit more cautious because the energy is higher, the half-life is longer, meaning that it stays within the system longer. And then it is taken up by cells that are rapidly proliferating. So it is absolutely contraindicated in pregnant women. So if a woman has thyroid cancer, for example, and then you now want to treat her with radioactive iodine, we would have to wait for her to have the baby first. And then she will also have to finish breastfeeding.
While the cancer is progressing.
You don't understand why? No. There are alternatives to breastfeeding. Let the baby take the formula. Let the mother be preserved and saved, because if it comes to that anyway.
Yes.
But most times,
I don't know if the right word to use is good, but compared to other cancers, thyroid cancer is one that doesn't progress as rapidly as some other cancers. So this is actually good for us. So if a mother decides that she wants to breastfeed, you can allow her to breastfeed, and then she stops breastfeeding. You give the breast time for involution, because we know that when a woman is breastfeeding, the breast cells are rapidly proliferating. If you give radioactive iodine, it's going to go sit in the breast. So you have to wait. Yes, so you have to wait. So she stops breastfeeding, and then you have to wait a few weeks for the breast tissue to involute completely, and then you can give your radioactive iodine. Another major precaution we take is when we give females of childbearing age radioactive iodine, they cannot get pregnant for at least 6 months.
Okay. Not bad.
Because, like I said, it has a longer half-life. It stays in circulation for longer. And because we know when the thyroid develops in the baby, we have to wait to make sure that there's no radioactive iodine in circulation before she gets pregnant.
Okay.
So I would not say we do not give to women. Radioactive iodine is contraindicated in pregnant women and in women who are actively breastfeeding. However, for females of childbearing age, you can absolutely treat them, but you have to take all the necessary precautions, and then we work closely with the endocrinologist and gynecologist.
The outcome, if there is any for treatment?
So the outcomes vary depending on the stage of the disease. For patients that have less aggressive disease, the outcomes are better. So you can have like, I don't know the word, progression-free survival of almost 100%.
Wow.
However, for patients who have advanced disease, at diagnosis there was already lung metastases or bone metastases, progression-free survival drops to 50%, 70-50%. So yeah, the outcomes are good when treatment is started early, and the treatment process is followed. The treatment protocol is followed, because I find that especially in countries like Nigeria, where they don't have access to nuclear medicine, patients get surgery and then that's the end.
Wow, patients get surgery and that's the end. That is not a good way to end this program. But for us to end it on a good note, where can people access this in Nigeria? Do we have centers?
Exactly.
Yes.
Yeah. For our viewers, we
we need to know have centers.
There are nuclear medicine centers in Abuja at the National Hospital, in University College Hospital, Ibadan, and I think
not in Lagos. You have been calling Ibadan, and I'm feeling offended. Not in Lagos.
I think there are some private centers in Lagos.
Private. Yes. No government.
None that I'm aware of.
Wow.
Well, thank you so much, Dr. Momodu. Yes, it's really a pleasure having you again on our program, and I'm sure we'll see call on you again, because you know you are like we said, you should be in the museum. You are not very easily accessible, but now that we have you here, I think we'll invite you again before you leave the country. Thank you again for coming on our program. We really appreciate you. And for our viewers out there, I'm sure you had a good time hearing from Dr. Momodu. on the role of nuclear medicine in thyroid diseases. All you need to do is go and see your doctor. If there's a need for you to have a nuclear imaging, it will be done. My name still remains Dr. Martina Agberie, and for next time, don't come alone. Keep watching The Physicians with your family, with your friends, with your colleagues. Pick your phone and let them know that The Physicians is about to start. Stay tuned or stay blessed.
Thank you very much, Dr. Momodu. It's always exciting having you here, and of course breaking it down for us on various topics when it comes to, nuclear imaging. To all our viewers out there, thank you very much again for always keeping it up with us. 7:30 p.m. West African time every Saturday, and of course, telling your neighbors and sharing the good news. And this is one topic you wouldn't want to miss. Be kind to follow us on all our various social media platforms, Twitter, Instagram. It's no more Twitter, X, right? X, Facebook, Instagram. You want to binge? This is the right place to binge. We have over 200 videos on our YouTube page. Please take that chilled water, chilled soap, chilled color drink, and of course, binge on all our various social media, various videos, and of course, follow us on all our social media. If you want to be a part of the show, just like Dr. Momodu, you are just a click away. Go to the website, fill that form, and you'll be right here. My name remains Dr. Imuna Yusuf Kadri. Until next time, remain blessed.